Hello, hello, hello. Good morning once more. If you're just tuning in, a great morning to you. I hope you're doing great. And thank you for tuning in with us right here on Prime Morning. Like we always say, we hope that you're getting interactive with us on all our social media platforms. It is time for Good Living segment. It's a segment that we talk health. Every single thing that you need to know about your health. We bring the necessary topic, diseases, viruses, bacteria, every single thing that you need to know about your health. We bring it on here. We get expertise on here to get you abreast with all the necessary things that you need to know about your health. And this day, today, is going to be no exception of proper and in-depth education on glaucoma awareness. And so I urge you, viewers, ladies and gentlemen, please and please and please, any questions that you have about glaucoma, what is it that has been bothering you about this topic? Please start sending your questions. Our WhatsApp number is very active. It is 055 157 5757 055 157 5757. And when I was researching about glaucoma, one thing I chanced on was that as of 2019, globally, about 700 million cases of glaucoma were recorded, meaning that people living with glaucoma were about 700 million. And then we had about 600,000 of people who are blind from glaucoma. And when you come to Ghana, that same particular year, as of 2019, about 700,000 cases were recorded. 700,000 people living with glaucoma were recorded, and about 60,000 people had gotten blind from glaucoma. And I remember that the deputy minister at that time did mention that it is, estimated that as of 2020, there's a high possibility of the cases increasing. We are in 2024. Has the numbers increased? Has it declined? Because the numbers that they were expecting in 2020 when it comes to people living with glaucoma was 900,000. Very alarming. And so I have seated with me this morning. It is time for us to, it's a Glaucoma Awareness Week. And so we need to let you be aware of glaucoma. And so I have seated with me this morning Nehemiah Hammond, who is an Ophthalmology Resident with Korle-Bu Teaching Hospital. Good morning.
Good morning. How are you?
I'm good. How are you?
I'm fine.
Is it the awareness? Is it just a week or is the entire month?
No, it's the month.
The
month of January.
Okay, so the entire month we are doing the awareness of glaucoma.
Yeah.
How I wish it would go on and on and on because unfortunately it looks like the cases or the numbers keeps on increasing. Like I did say in my introduction, I'm not too sure about the cases now, but since you're an expert, you definitely let us know whether or not it has increased in 2024.
Okay, so thank you very much, and I'm happy to be here.
Yes.
So studies are still being done over the years and then in different regions of the country, but the numbers are still increasing.
Wow.
Because of more education, people are becoming more aware of glaucoma and then are getting treatment, but a lot more people are still not aware.
Yes.
And that is why glaucoma is called a silent thief of sight.
Right.
Because about half the patients with glaucoma are not aware that they have glaucoma. And so by the time they realize it's almost always too late.
Yeah.
And that is why we need to talk about this more.
And I'm glad you're here to talk about it.
I'm glad to.
And right now, I'm just wondering that if there is any stage of glaucoma that could possibly be corrected or nothing at all. And so viewers, get interactive with us, start sending in your questions, and Nehemiah here is going to answer everything for you. Now let's get started with what glaucoma is, and then we'll get to the types and we'll break it out.
All right. So glaucoma, it's a group of diseases that affects the optic nerve. Now, the optic nerve is a nerve at the back of the eye, which transports visual signals into the brain, and that allows us to see. And so whatever signals we are picking from our environment, the optic nerve processes all that and then sends it to the brain. And so if for any reason at all that optic nerve is damaged, then you are going to have problems with your vision. And the thing with glaucoma is that the loss of vision is from outside and then comes in. So by the time you realize it's too late. So glaucoma is basically an optic nerve damage issue.
When you say it's from outside and then comes in,
What
to the
exactly?
break it down for that.
Yeah, so it means that it affects the peripheral vision. So when you are looking straight, a part of your eye is supposed to see outside of you, so
Right.
that if something is coming,
Yeah.
you're able to.
Yeah.
But with glaucoma,
What we call the corner of our eye.
the corner of your eyes, yes, very
Right.
good. So, but with glaucoma, that part is affected first, and so you are not able to see more to the corners of your eye. You are just seeing what is in front of you.
Right. Then it just gradually comes.
Gradually
and comes
shrinks, gradually shrinks.
Right.
And God is so wonderful. He gave us two eyes. And so a lot of people have glaucoma in one eye, but because the other eye is working, they're able to live their lives up until a point where, for instance, or by chance, they cover this eye and then they realize that I can't see with my left eye. So that means that the damage has been going on for some time, but was only recognized a bit later.
So does it often only happen with one eye?
So it can happen with one eye or both. It can do
Okay.
both one eye, either one eye or both.
What's the probability?
So most of the cases that we see, they happen in both eyes. But sometimes you can just have it in one eye. And so you need to be very aggressive and protect.
So you would say that even with a one eye, that is quite rare in Ghana?
No, I wouldn't say it's quite rare.
Okay.
It's quite common that you
Common.
see in one eye.
Okay.
Yeah. But it can
Okay.
happen in both eyes as well.
Okay, now let's come to exactly what causes glaucoma.
Okay, so we, like many things, is that we actually do not know what causes glaucoma up to now. Research is still going on, but we have identified some risk factors.
Okay.
And so risk factors are things that are either on you or that you do that make you more likely to have the disease than someone else. Okay, so some of the risk factors that have been identified are increase in the eye pressure. And this is one of the main risk factors that we can actually do something about. And so that has been the target of most glaucoma treatment or management. When the eye pressure goes too high, that is a risk factor. Other risk factors are age. So above 40 years, you are more at risk of glaucoma. And then race.
Okay, I want you to take your time with us,
Okay.
okay? The pressure on the eye, the first one that you mentioned, when you say pressure on the eye, what do you mean? Like,
So-
is it that you watch the screen for too long? What is it exactly?
So there's a fluid produced in the eye, and then that fluid is drained as well. So there's a healthy balance between the production of fluid and then its drainage. Let's go to the kitchen. So you open the tap, water is draining into the sink, and then it goes down. The rate at which the water is coming down, it should be the same rate at which it is drained. If for any reason there is a blockage in the pipes, then the water builds up, it builds up. So it's the same. The eye is like a ball. And so when the water is released, it has to be drained. But if the water is continuously released more than it is being drained, then that ball keeps expanding, and then the pressure in the eye keeps going up. So we call that intraocular pressure. The pressure in the eye keeps going up. And so when the pressure goes up, that is a risk for glaucoma.
And what happens to the eye? Do you start tearing unnecessarily?
Yeah, so in some types of glaucoma, you can have tearing, you can have redness, you can have headache, nausea and vomiting.
Nausea and vomiting?
Yes, that's what we call the acute angle closure glaucoma.
Ooh.
Yes, so in that type, the angle that drains the fluid is closed. And so the pressure is very high. And then that is what causes all of that. But normally, when the angles are open and you have glaucoma, you are usually not having any symptoms. And that is why it is dangerous, because you are going about your normal life.
Right.
But then the vision keeps shrinking and shrinking. Yeah.
Wow. Now, you mentioned age. The next one you mentioned was age as well.
So aside age, we have race as well. So as Africans, Latinos, and then Asians have been found to have higher risk of glaucoma than the Caucasians.
Whoa.
Yes. So that's also interesting.
Why is that?
It is still being studied. We don't know. But
Wow.
one other risk factor which you can relate it to that is myopia or short-sightedness.
Okay.
So there are some people who only see what is in front of them but cannot see what is far away. And those people who have that condition, they have also been known to have higher risk of glaucoma. And most of the Asians are short-sighted, so maybe that's the relationship there.
When you say age, what's the range?
So about 40 years
Okay.
is when we start getting worried.
Okay.
And so we usually advise that once you hit 40, you should start getting your eyes checked. Another important risk factor is family history.
Okay.
So if your mother or your father or someone in your family close to you has had glaucoma before, then your chances of getting glaucoma also go up. And so it's important that whenever we visit the hospital, we should find out what the diagnosis is. There are a lot of people who go around who are blind and they don't know exactly what is causing the blindness. And so if you find out and you know that it's glaucoma, or my father had it, or my mother had it, or my grandmother had it, then it informs us that we are more aware and more cautious in dealing with you. So family history is a very, very important risk factor, which all of us should focus on.
There is nothing like lifestyle that could possibly be a risk factor?
No, so studies haven't shown any relationship between lifestyle. Yes, but the established risk factors are what I've mentioned. So you have the elevated eye pressure.
Right.
You have the age, about 40. You have the race. You have family history. And then you have the short-sightedness. These are the well-established.
So it is only people that are above 40 years that could possibly have glaucoma?
So the going above 40 years increases your risk.
Okay, but below you could?
Yes, so the types of glaucoma, we have something called congenital glaucoma, which happens in children. So babies are born and then their pressures are high. So it does not only happen in the elderly.
In the elderly, but children as well.
In children as well.
Now let's come to the types.
Yes, so as I said, we have open angle, and then we have closed angle.
Okay.
So open angle is where the angle that drains the fluid is open, and yet still you can have the glaucoma, or the angle is closed. So when the angle is closed acutely, that is what becomes an emergency. And that's what you get the redness, you get the pain, you get the headache, the nausea,
vomiting. Right,
yes.
right.
That is acute angle closure.
Okay.
And then we have the open angle glaucoma. We also have secondary glaucoma, where the glaucoma is caused by other eye conditions. Okay, so once you identify those conditions and then you treat them, the glaucoma should get better or should resolve. Then we also have, like I said, congenital glaucoma. We also have juvenile glaucoma, which happens in adolescents. Yeah, so it just occupies the whole spectrum. So those are the types of.
I wish we could get this on the other side so that Dr. Nehemiah can really. It's actually behind you, what I'm talking about.
Oh, okay.
So the open angle glaucoma.
Yes.
Okay.
So this picture is showing the eye pressure increasing. So as I said, the eye is like a ball.
Yeah.
Yes, and so once the pressure increases, it puts unnecessary pressure on the optic nerve, which is the yellow thing at the back there.
Right.
Yes.
Yeah.
And so the more the pressure increases, the more the damage to that nerve. And the sad thing about glaucoma is that it is an irreversible cause of blindness, which means that it cannot be reversed. So the vision that you come with at the hospital, that is the best vision that you are going to have. And so, because it's progressive, it gets worse. But what we do is try to slow down the progression so that you don't lose your vision too quickly. But it's a progressive illness.
Okay.
Unlike cataract, which is reversible, which is the most common cause of blindness.
Wow. Okay, so with the same diagram.
Okay.
Right.
So down there we can see what we call capping. And these are effects on the disc as well, which is part of the optic nerve that I was talking about. So that is showing damage to the optic nerve. Okay. Then to the right, we have the angle that I was talking about.
Right.
That's where that meshwork, that is what drains the fluid that is produced. So it's like a net. So once the fluid is produced, it's supposed to pass through there and then drained. So production, drainage, production, drainage. So once there's an imbalance, then the eye pressure goes up and then we have damage to the nerve. So the picture up right
The
that is
tonometry.
So that is a way to measure the eye pressure. So usually, we say the normal eye pressure is between 10 and then 21, but it has to be individualized because there are some people for whom, even though their pressure may be within the normal range, like say 18 or 19, because of the severity of glaucoma that they have, we want to bring their pressure lower than that, okay? So every patient is individualized, but usually between 10 and 21, you are okay.
Okay.
Yeah, but there's also something we call normal tension glaucoma, which means that even though your pressure is normal, you can still have glaucoma. That's why we say increased eye pressure is a risk factor, but its absence does not mean the absence of glaucoma.
Oh.
Yeah.
Right. Okay. And then we have the what?
And then the one to its left is latanoprost side effect.
Latanoprost.
Yes, so latanoprost is one of many medications that is given, like eye drops, in trying to lower the pressure in the eye.
Okay.
Okay, yes. Okay. So some of the medications have side effects, and it's important that you know that, so that when you start using it and you get the side effect, you don't just stop. Because once you stop, the pressure will go back up again, and then the damage.
So you have to continue.
Exactly.
Wow.
Exactly. So you have to use some of.
And with that, for how long?
It's usually for a long time.
For a long time, maybe like till. Yeah, on ending.
Yeah.
Wow. And what about the halo surround lights?
So
the left side?
That is part of the symptoms of acute angle closure. What I was talking about, the emergency, where you have the headache, the nausea. So halo around lights is one of the symptoms that you have, where you look at the light and it's like there's a ring around it or there's a rainbow around it. That's part of the symptoms that will let you know that the pressure is high or you have glaucoma. One
thing that I noticed with the eye is as you're aging, it seems that the color of the eye it becomes lighter. How is that?
So when you say lighter,
lighter, as in like for older people, it's not as dark. I'm talking about what was it called? Is it the pupil?
Yeah, the pupil is the small.
It's the smaller one. Yeah. So the bigger one is called.
So that whole front is called the cornea. That's transparent.
Okay, the whole front is the cornea.
Yes, where you see the black.
Yes.
Yes, because behind it you have the iris, you have the lens, you have all of them.
Okay.
But if you see any whitening, is that what you're talking about?
Yes.
If you see whitening, it's likely to be cataract, because the lens, as you grow, it becomes opaque. As you are young, it's transparent, so light can pass through.
Right.
You are not seeing it. But as you grow and then there are some changes that occur, it becomes opaque, it becomes whiter, and then that is what we call cataract.
What are the cases that you receive most when it comes to the types that you just mentioned?
So the most common type that we see is the primary open-angle glaucoma.
Okay, the one you just explained.
Yes, so where the angle is open, it's not closed. So the angle is open, but yes, still the pressure is high, and then there is damage to the nerve at the back. Yeah, so that is the most common one. But we also get the closed angle one, but not as commonly as
commonly.
And that is consistent with global results or incidences. You have more people with open angle than the closed angle ones. And then the children also come with their congenital ones as well.
Well, I'm wondering, okay, so with the cases or with some individuals here in Ghana who most probably have not really, the awareness has not really reached them, when you encounter people like that, I'm sure that they tell you, oh, I did this, I did that. This is how I was treating it. I thought it was this. What are some of the cases that you hear often? Yeah,
so most of the time, as I said, they don't know.
Yes.
They are not aware of the condition. And so when you tell them that, and so because they are not aware, the damage has gone to a very large extent. And so when they come and we tell them, sometimes it's difficult to believe, because they'll say, this blurred vision or me not seeing just started like a few weeks or months ago. But when we examine and we look at the back of the eye, we see that this damage has been there for a
longer time.
So it's difficult for them to reconcile the fact that they have had that damage for a while, but because they were not aware, they were just living their lives. And so sometimes most patients are in denial because they can't believe that this is happening to them. And so sometimes they go and seek other forms of alternate treatment, but they always end up coming back much worse.
Yeah. Okay, I want us to come to children. Okay. What would you say would be the case? Is it increasing, especially in children? Do you get cases of glaucoma in children often, or as compared to adults, it's not that often? And what's the age range that you get cases of glaucoma?
So in children, when we say congenital glaucoma, it means that it's from birth, and so we see quite a number of them in the clinic, and then as once we see them, they become priority for us, because once we are able to do surgery and then control the pressure, it protects their vision for a much longer time. The sad aspect is when they do not come early. So that applies to both children and adults. If they do not come early, then even though we may do the surgery, the prognosis or the visual potential is quite poor. And for children, they have to see to be able to see. What I mean is, if there is any reason why children are not able to see as they grow or as they develop, it becomes way more difficult for them once they grow up to be able to see, because their vision or their nerves are growing as they are growing. Their visual potential is growing as they are going. And so the more they see, the more they are exposed to light, the more they are exposed to images, it makes their vision better. So if there's something blocking their vision, or there's a problem at the back where they're not able to see, it just goes downhill from there. So we always advise and counsel that if you see that your child is not able to, you notice that your child is not able to see, the child is not following your movement, the child keeps bumping into objects, you have to be quick and then bring them so that we have a look, because the earlier we solve their problems, the better it will be for them.
We'll bring an extensive conversation on that next week, God willing, and also this whole conversation on screen time for children, because people have diverse opinions in relation to that, and so we'll delve into a deeper conversation on that, God willing, next week. So viewers, you have to stay tuned for that, especially if you have a child or if you have nieces and nephews who are very little. You need to stay tuned for that. Right, so okay, do we have some comments? So please, viewers, if you haven't sent any questions, I know there are questions, there are certain things that are bothering you about the eye. Nehemiah here is ready to answer it all for you. We are talking about glaucoma. If you have an adult in your home, a parent, a loved one, please, whatever situation it may be surrounding the eye that you are quite uncomfortable about, or you are not too sure of, please send the message or the question to our Facebook page, the comment section, and then ask. Our WhatsApp number is also very active. Nehemiah will help you to understand exactly what is going on. Now, with the adults, glaucoma. So when you diagnose an adult that you've got glaucoma, what next?
Okay. So before I answer that question, I want to talk about how the diagnosis is made.
Okay, great.
Yes.
Great.
So once you come in, usually they'll come with maybe blurred vision. They are not able to see well.
Okay.
And so once you come in with that, we examine you. We check the eye pressure using the tonometer. The tonometer. And then we assess and make sure that your pressure, whether it's normal or it's high. Sometimes you see the cornea that I was talking about, the transparent film in front of the eye. Based on its thickness, the eye pressure can either be overestimated or underestimated. So we take all those into consideration. And then we'll put in some drops to dilate the eye, to open the pupil, to make the pupil bigger, so that we can look at the back of the eye.
Right.
And that is where we are looking for signs of damage to the disc. That's the optic nerve. So we are looking for signs that there could be some damage to the disc. Once we see that, there are other investigations that we'll do. So we'll do what we call a visual field testing. And this is where different lights of different intensities are thrown at you, and you are to click. There's a button that you click that tells us whether you see the light or not. And so this tests both your central vision and the peripheral vision that I was talking about, the corners of the eye. So we have an instrument where you will do an extensive check of your visual fields and make sure that your visual fields, whether they are normal, whether they are abnormal. Then we have other scans too that tell us the thickness of the disc and then the layers of the retina. So we combine all of that in addition to the history or the questions that we have asked you. So this is where the age, the family history, all of that comes in, whether you wear glasses or not, short-sighted or not, all those things. Then we combine it together and then we make a diagnosis of the glaucoma. Now, once we've made the
before you continue, right? So last week, I know an older woman who texted me on WhatsApp. So I was supposed to have gone to see her for something, right? But then she was unavailable because she had to go to hospital to get her eyes checked.
Wonderful.
So she came back. She texted me and she said that, "Mommy, what is refraction?" Because they told her that she has to do refraction.
Okay.
And she was scared, wondering that, there's probably something really wrong with her eye. So what really is refraction?
That's a very good question. I mean, your grandmother, your old woman, she's on point.
She's on point.
So refraction is a test used to check if there are any errors with the way you see.
Oh, okay.
So when I was talking about people who see things closer to them or those who see things far away. So there are those who see things just when they are close but not far away. And then there are those who see more far away when they are, and then they don't see when they are close. So that's short-sightedness, long-sightedness. So the refraction is a test done to check the refractive state of the eye, how well the lens and the cornea are able to bend light so that you are able to see. So that tells us whether you are short-sighted, long-sighted, whether you have any combination of these errors or not.
Okay, yes. So you do that for the...
Yes.
So I was on point.
We do it at our unit.
Right. Okay, so let's continue with, and then you get the test done, you get the prognosis, and then...
So after you get the diagnosis, so we tell you that this is what is wrong with you. And one of the main things that we try to do is to bring down the pressure.
Okay.
Yes, and so based on the level, sometimes most of the time we give eye drops. There are different eye drops on the market which affect different parts of the eye and so control the pressure that way. So we have basically 4 main groups of drops or of medications which are affecting the eye pressure at different levels. And so sometimes based on your condition, we can either give you 1, we can give you 2 or 3.
Okay.
And some of these are combinations of each other. And so you see someone with maybe 2 or 3 eye drops and they are putting all of them on their eye. It means that their pressure is way higher than someone who maybe is just putting 1 drop. Okay. So we have pressure lowering drops. We have oral medications too. Okay. In some cases, when we want to bring the pressure down really fast, we give oral medication as well.
Okay.
And then there is space for surgery. And most people are kind of averse to surgery because most people have different fears.
I mean, to hear that your eye will be operated on...
Most people cannot even think that the eye can be operated on. Yeah. But surgery has been found to have really positive effect on reducing the eye pressure. And so sometimes when the surgery is done and it's successful, it reduces the number of eye drops you are supposed to take, or sometimes you don't even take at all when the surgery is quite successful.
Nehemiah, I don't know if you might have chanced it on this on social media, but some individuals were selling this eye drop that when you drop on your eye, it clears the eye, and then the parts where it's white, you see that as you age,
it becomes
brownish. So that drop, that liquid is supposed to help clear that.
Okay.
I have chanced on a lot of it on social media.
Really?
On IG, on Facebook. People are selling these things.
I haven't seen any.
And I wonder if it's good or if there's any such thing.
So that brownness that happens when you are growing, it's all part of the normal aging process. And basically, because we are in the tropical region, that our environment is very dusty.
Yes.
And so you have a lot of we call them pigmentary changes that occur on the conjunctiva, which is the white part of your eye.
Okay.
And for me, I don't know any medication that is supposed to
on IG and Facebook.
Clear. Then the FDA really needs to get into it and make sure that it's
then they have to.
As far as I'm concerned, there's no drug that I know that's supposed to clear the white.
So there is nothing like that.
No, as far as I know. No.
So viewers, for those of you that might have chanced on this on social media where people are selling eye drops that are supposed to clear your eye for it to be as white as snow or as clear as that of a newborn baby, please, you need to be very careful. So you're not a newborn baby. I don't know what it is about having a white, clear...
Social media, man.
Social media, exactly. So please, you need to be very careful out there exactly what you buy online. Now, let's come to the surgery.
Yes. So, as I said, surgery is part of the treatment for glaucoma. And so we go into the angle and then we do surgery there. And it's supposed to bring down the eye pressure. Sometimes we even put in some drainage devices as well. I told you about production and drainage. So if your drainage system is not too effective, sometimes we can supplement it by inputting a drainage device into the eye as well. And then sometimes we use laser to also target the angle. And then all this is an attempt to reduce the eye pressure and so reduce pressure on the nerve and maintain the vision that you have.
So when somebody walks in and comes, what is it about the eye that makes you know that, no, this one is, there's nothing that can be done about it?
So in one of the previous pictures that you showed cupping. So the disc or the nerve at the back of the eye is like a donut. You know, a donut has the outer ring and then the inner ring. So there is a certain ratio that we need the back of the eye to be. When the glaucoma has affected the nerve that bad, that ratio, the outer ring gets closer to the inner ring.
Okay.
So the inner ring is very close to the outer ring. And so when that happens, you know that the chances of them seeing are very, 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 very small.
Very low.
So we call that capping. When the capping is quite extensive, the prognosis is quite poor.
Nehemiah, what would you say we should do on a regular day? What are some of the things, both children and adults? What can we do?
Yeah, so the first thing is in identifying the risk factors.
Yes.
Because there are some people who come and we call them glaucoma suspects.
Okay.
We call them glaucoma suspects because even though they may have certain risk factors or their pressure may be high, we are not seeing any disc damage at the back. Okay, and so based on the history that we take, these people are managed differently.
Okay.
So once we know that you're a glaucoma suspect, we let you, or we do a lot of tests, we monitor, and then we make sure that your pressure is always within the normal level.
Okay.
And so what I would advise is that we should all get screened, all get information about our family history and find out if there's anyone in the family who has had glaucoma. You should know. Okay, so if you have your brother, your sister, uncle, grandmother, grandfather who is having eye issues, find out from them. Were they told that they have glaucoma? If so, are they on medications? And then that would further inform you to be able to inform us that this is what, or this is the situation you are dealing with. Also, you have to be visiting the eye clinic whenever you have any issues with your eye. And so that is what I would say. And then once you hit 40, you should definitely make a visit to the eye clinic so that we check your eye pressure, we check your refraction, make sure that everything is within normal.
So just go and get your eye checked.
Yes.
It's very important for you to do so. Viewers, I'm seeing so many questions and comments and messages coming in. Thank you all, but unfortunately we are pressed for time. But next week, God willing, Nehemiah is going to come back and we will deal with every single question of yours that you have sent so far. He will delve into that for you. So we'll keep these questions and keep the questions coming in relation to glaucoma. And I promise you that next week, God, when Nehemiah Hammond comes into the house, we are definitely going to delve into all of that for you. Nehemiah, thank you so much.
Thank you so much
for being here. And before you go, how often exactly do you have to do this, the testing, going to check your eye?
No, so once you hit 40, at least every year, you should make a visit to the eye clinic. And then let me chip this in. Once you have hypertension or diabetes, you also have to check your eyes every year or at least every 6 months because those chronic conditions also have effects on the eye as well, especially the back of the eye. And so it's important to check that.
It's very important for you to check out. Nehemiah Hammond, thank you so much for your time. Thank you for the information that you have given us. And so, viewers, I hope that you've learned a lot. My guest has been Nehemiah Hammond, who is an ophthalmologist resident at Korle-Bu Teaching Hospital. Thank you once again. Have a lovely morning.
You too.
And so, coming up next is a gospel musician. She has something amazing coming your way. There's